So welcome to Coping with the Use of Drugs and Alcohol, a discussion of treatment barriers and approaches across different age groups with Jason Zeltser, a clinical supervisor at La Familia Counseling Center. So La Familia's Recovery and Wellness Department houses programs that provide substance use treatment services, individual and group counseling, crisis intervention, medication assisted treatment, and more. The programs in our Recovery and Wellness Department serve adults and adolescents in Alameda County. So thank you so much, Jason, for being open to present today, and take it away.
Thank you, Percy. It's really a privilege to be here today and an honor to talk with everybody. We're just going to sort of take off here. I'll be introducing some of what we'll be talking about today, and then you'll hear from some of our counselors discuss their work in their respective programs and the way we sort of tackle and integrate our work in our LatinX community across Alameda County. So I'm going to share our presentation now.
So welcome to Coping with the Use of Drugs and Alcohol, a discussion of treatment barriers and approaches across different age groups with Jason Zeltser, a clinical supervisor at La Familia Counseling Center. So La Familia's Recovery and Wellness Department houses programs that provide substance use treatment services, individual and group counseling, crisis intervention, medication assisted treatment, and more. The programs in our Recovery and Wellness Department serve adults and adolescents in Alameda County. So thank you so much, Jason, for being open to present today, and take it away.
Thank you, Percy. It's really a privilege to be here today and an honor to talk with everybody. We're just going to sort of take off here. I'll be introducing some of what we'll be talking about today, and then you'll hear from some of our counselors discuss their work in their respective programs and the way we sort of tackle and integrate our work in our LatinX community across Alameda County. So I'm going to share our presentation now and make sure that everybody is able to see it. So today you're going to learn a little bit about our organization. We're La Familia Counseling. And we're from the Recovery and Wellness Department. So we have several different departments working with intersecting with mental health in the legal system, helping folks with our reentry program after they get out of prison or jail. We have programs in outpatient, developmental programs. And so we have a lot of different stuff going on, but today we're going to talk a little bit about our Recovery and Wellness Department. As Percy was saying, we work in SUD treatment, individual groups. Today you'll hear about our youth program, our adult outpatient program, and our adult male residential program. Hopefully you'll understand some of the factors that are relevant to our Latinx community in Alameda County and their struggle with managing substance use and alcohol. And the theme of our presentation will be that we weave in a specific barrier of labels and how labels to treatment, labels from family, society, they influence how treatment begins, they influence how treatment goes, and the outcomes and effectiveness of the work we do. Again, my name is Jason Zeltser. I'm a clinical psychologist and a supervisor for all of the department. Today, we'll hear a presentation from Proyecto Primavera, which is our youth program, and Erica Garcia will be talking.
Hi, everyone.
Hey, Erica. Our Latino Family Service Center works with adults, men and women, and a Women's Enhancement Services program where we work with pregnant women and their SUD recovery. And Daniel will be talking today, Daniel Amaya.
Hola a todos. Hi, everyone.
Lastly, we'll be talking about our men's residential program, El Chante Recovery Home, and Aura Gonzalez will be talking to us about that today.
Everyone, thanks for having us.
Though we don't have any representatives of our MPTI program, La Familia is involved in the psychology training program of social workers training and MFTs, and family marriage therapists, and also psychologists. And we have 4 trainees right now working in our residential facility. So they're a part of our team too. We want to give them a shout out. Briefly, I want to talk a little bit about the history of La Familia. La Familia has been around for quite a long time. It began as a grassroots movement to support the bicultural and bilingual mental health services in Alameda County. In 1989, they started their first training program, teaching providers to integrate bicultural and bilingual services into what they've been doing. In 1994, the Hijos de Sol organized a massive walkout by Dolores Huerta demanding culturally sensitive curriculum in the Hayward public school system. This started to mark our interaction with the school systems and to improve our youth program that got launched a little bit later. 2007, we became a union organization which supported a lot of the SUD programming that happened about a decade or less later. 2015, the Latino Family Commission was established, and it joined La Familia Counseling to launch our recovery and wellness department. We had a few different programs merge with us. One of them was the outpatient Si Se Puede, and they merged with La Familia Counseling and is part of the Latino Family Commission now. Also in 2015, we became the first mental health provider for the unaccompanied immigrant youth program here in Alameda County. And you'll hear a little bit about that soon here. Really, a really amazing program to be involved with. Our mission is important to us. We want to serve the underserved multicultural communities, but our focus is in building resilience, wellness, and economic strength and power. For a long time, our LatinX community have been disempowered, their voice lowered, and their reach lessened. La Familia Counseling really strives to bridge those gaps. Values in belonging, partnership, self-determination, our social justice, advocacy, and integrity, that we all get the treatment that we deserve, fair, basic, and humane. That's a little bit about our organization. These things are things that I find important and valuable, and why working there feels meaningful. I'm going to transition to talking a little bit about coping with drugs and alcohol, and a little bit about our philosophy and our view and our training and our work. And the counselors will take some time to talk about their programs. You know, in introducing this topic, I wanted to spend most time having our counselors share about their experiences. I think it's important to start with language, because language is going to be one of the vessels in which we feel heard, treated well, and bridged to the necessary interventions or resources that we need to succeed. For a long time, we've used the language of substance abuse in the field of recovery. But substance abuse we've seen has led to ideas of addiction as immoral character. Something's wrong with the person. Or it's a result of bad decisions, and empathy or understanding doesn't fit for someone who commits an act of bad decisions. We see the same shifts happening in criminality right now. There are more factors that go into our decision-making. When we look at addiction as a medical illness, we may miss something. We may over-pathologize and see our clients as living with something completely uncontrollable. Something that they should always expect to struggle with. But really for us and our team, the way we train, the way we try to work and what we strive for is to see addiction as this challenging mosaic of a lot of different factors working against each other. Of course, you have the direct effects of misusing substances, and we can see what that looks like on a biological, physical, and social way. But there are biological predeterminations, things that we don't quite understand about our genetic leniencies, traumatic past experiences that are manifested and felt differently person to person. Sometimes our folks deal with mental health problems that come from using, come from induced by the drug itself. They carry serious mental illness. They carry mental illness that was unresolved. There's social pressures, family obstacles, rejection from multiple levels, abandonment from multiple levels, lack of adequate living circumstances, problems with self-care, diet and nutrition, education that's not there. This is, when you look at the mosaic of addiction, you see the effect of how communities are working. You see the effect of the legal justice system. And of course, you see the effects of prejudice and labels that we're going to be talking more about now. Labels to treatment. They're a part of our treatment. There's something to always be contending with. What do labels do? They keep affected groups in inferior positions in society. I think that's one of La Familia's missions, to try to build the voice, reach, and power of our LatinX community and other underserved communities that we reach. Labels are our views, perceptions, expectations, identifiers, stigmas. We see them at the systemic level, social level, school level, family, and ultimately self-stigma. The way that all these views, perceptions, expectations make us then feel about ourselves. How do we know? What do we see? Well, I think we see labels in many, many ways, from advertisement to behavior, actions, in the political scheme, in the political sphere. You see this everywhere, but today we're going to talk about communication. We see the labels in the way we communicate, both overt, covert, both verbal and nonverbal. The ways we see people, talk to people, or dismiss people, and expect things from others, or expect less. Counselors will begin to talk a little bit about their programs, and they're going to be weaving in these levels of labels and how they affect their work and their clients they see, and also shed a little light on what they do to combat that, to mitigate the labels that are ultimately influencing the outcomes of our treatments.
Hi, everyone. I want to share with you about a young adult, 19-year-old, unaccompanied immigrant student who I had the privilege of working with. When I met him, he had been in the US for 1 year. He told me he He used alcohol almost every day and his use was increasing. He told me one session that he didn't feel accepted at school by other students or teachers, that he felt like an outsider or just wanted a drink. I wanted to understand his unique experience. I found that allowing him to express himself in his native language was the beginning. I listened to his story, his feelings, and was patient with him, finding his motivation within himself. I felt no need to judge, only can find safety within this. Only validate the difficulty of trying to deal with being dislocated from his native environment. I tried to show him that he can find safety within this new world, even if it starts with me. I connected him to additional resources for bilingual students and advocated on his behalf with school staff. By the time he completed the program, he had stopped using alcohol and carried with him a set of adaptive coping skills for his future. So being able with, and then we're gonna go into youth SUD treatment in what we do within our programs. I'm a substance use counselor with the youth. I work I am stationed at Redstone Newcomers, Oakland International. I also work with youth in the office-based services. We also work within our program with group sites, such as Greater New Beginnings, and we are also offering services at juvenile hall. We offer bilingual services, which is one of the essential pieces to what I do within the school sites that I am stationed at. And being able to offer and meet the youth where they're at is very important. I found that it's meaningful to be able to allow them to feel comfortable and feel safe, not feeling like out of place because they don't know how to speak to me in English, right? Or they feel more comfortable speaking to me in Spanish. A lot of the youth that I work with at Oakland National High School and at Redstone Newcomers are unaccompanied immigrant youth, meaning that they've come recently from Honduras. A lot of them are from Honduras and Guatemala, recent as a few months. So being able to meet them where they're at, before the use becomes excessively where they won't show up to school is very important, right? And that requires a lot of harm reduction work. Our goal is not to make our youth stop. Because if I approach a youth with the idea you have to stop using, and the way that other people have approached them, their response is going to be like, I don't want to deal with you, right? So there has to be an approach where it's like, I'm here to listen to you. I'm going to provide you with this time to speak to me. And we could talk about your use, or we could talk about whatever it is that's leading to your use and how you're feeling, right? Allowing them to recognize that the feeling out of place is one of the reasons they're coping, right? Because they just came from Honduras or Guatemala, they're in a brand new world, other words, right? And they're unaware of all the support that there is in their surroundings. So being able to work with them one-on-one is very important in guiding them and allowing them to be aware that there's people out there like ourselves to support them throughout identifying their use, what is safe using, what isn't safe, where can they seek support if they feel like it's getting out of hand, or they've used a substance and they're unaware of like what the effects are, why they haven't slept for a few days, depending on what they're using, right? So the bilingual piece is very important, especially with our Latino populations. And being able to listen to them and respond to them in their native language is the most important piece, along with teaching our youth that using is what are the lead factors that lead them to want to use. So, and also allowing them to find that coping skill, those things that allow them to, so safer coping skills is what they're looking for. And I would utilize their strengths to allow them to find what it is that interests them, right? And this is through getting connected with different services within the communities, working one-on-one, meeting them in the school site if that's needed, or out in the community, in the field, at the park, if that's needed, right? Or more so being able to meet them where they feel comfortable at. And right now things have changed. So being able to be available through telehealth is very important, allowing them to have that safe space to feel that support, because a lot of our youth are feeling out of place. They don't understand, like they just arrive and a lot of them are marijuana users. They're using more marijuana because they want to be able to ignore the fact that they have a whole bunch of homework. So offering that one-on-one support is very important as well. And like, I'm here to support you in whatever it is that's leading you to continue that use. And let's try to work together 1 hour a day, whatever it is that meets the youth where they're at. And then also if they need a referral to go see a doctor, whatever it is that the youth are in need of, I am there to provide that support. The way that, so impact of labels and SUD treatment for Latinx youth system. A lot of it involves our youth are afraid of getting caught, right? They just came from Guatemala or Honduras, and they're afraid of taking part of treatment because of the fear of their immigration lawyer finding out that they're using marijuana, or in some cases it's alcohol or meth, right? And there is the fear of getting caught is what's retaining them from coming to treatment. For school, a lot of the teacher perspectives is very important. It plays a factor. If the youth feel like their teachers look at them differently because they smell like marijuana coming to their class, or they know that they're using substances, that affects the youth to a whole different level. And the family, feelings of unfairness due to family misusing substances. My parents are telling me not to drink alcohol, but yet there's always alcohol available in the fridge, right? And then the idea of like gateway to more problems, right? It's gonna lead our youth to use other substances, or it's a gateway to other uses. For social, it's weak or uncool. They want to be accepted. If that's what most of the youth are using to cope, it will be something that they need to be part of, right? For self, giving up on self, it's either one way or the other, right? If I'm feeling like our teachers are, if I'm being labeled either way, why even try to change it? So our job is to be able to offer this other opportunities, right? Our job is to make them become aware of their strengths. One of them being the fact that a lot of our youth learn English within a year, right? So I'm always pointing that out, like, come on, I grew up here. You could still hear my Spanish and my, accent of Spanish. My parents are Mexican, and, my first native language was Spanish myself, but I've been here for how many years? So pointing that out to the youth is very important. Like, nomás has estado aquí un año and you already know how to like write English, and you already know how to like, let's empower you. You have the ability to tell your story of what happened to you during that time that you were in that immigration holding center for that year, for that month, or 2 months, or 3 months, right? So being able to change that is very important within our youth. We empower them to recognize those things, because it has nothing to do with us. It's just being able to provide them the tools and utilizing the different evidence-based practices for them to capture what it is that they want to change, what it is that they want to do. And whether or not it's stopping use completely, or if it's just reducing their use in order to be able to complete their homework, right? Because I am stationed at a lot of schools. So at the school sites, the main reason they're referred is either they're skipping school, skipping classes, or they're not presenting themselves and doing their homework. So the work is around, how can we make it work where you start communicating with your teacher, I need this help? Because a lot of times they're in fear of even asking for help, right? Because they feel like, oh, the teacher's not gonna wanna help me, because they already look at me like I'm high 24/7. So being able to change that kind of thinking is very important as well when we work with Latino youth.
Thank you, Erica, so much for sharing about your experience.
Thank you, everyone, for listening.
I work with a 30-year-old man who began drinking at early age with his family in Mexico. He described childhood trauma and loss. For many years, he was led to believe that the woman who cared for him was his sister, only to learn that she was his mother. While in the US, his alcohol use increased and became dangerous, receiving 3 DUIs and being referred to me by court. He described that the pain and suffering and reaching sobriety for 6 years and then relapsing. He was concerned about his future. He makes me feel anxious. He was so impulsive and anxious himself, but I tried to stay curious and present. I think we realized by working together that self-acceptance needs to happen before change. Together, he became more aware of his patterns of feelings of hopelessness that lead him to drink. And I remember he told me, Daniel, I feel like I was reborn. What I know is that he left me with a new sense of himself and desire to absorb what he can from all of his experiences, good or bad. Now the miracle is that he's an active member of AA and focuses in helping others with their recovery, and he states that he's grateful for La Familia, and I feel grateful to be part of his journey. I work with the adult SUD treatment with our LatinX community in the heart of Fruitvale. Our program is a Latino Family Commission. We offer services for men and women in English or Spanish. We also work with women's. It's called WISA program with pregnant women and women with children under the age of 18. Our services are provided in English and Spanish. And we also, one of the challenges that we're having is like when clients are transitioning from residential, our community, I mean, we're not very educated about mental health symptoms. And at this level of treatment, mental health are a little bit moderate, mild moderate, because we don't really know, you know. We always talk, I remember they talking to me and saying, you know, I feel nervous, you know, estoy nervioso, you know, and it's, maybe they were having an anxiety attack. You know, big culture of prepared and educated is so important to work with this community, with this population. My personal experience also is a key for this, for me to be successful in this program and the personal connection I make with. I'm a recovery addict. I've been sober for 16 years. And I know what it feels like to don't have no support. And beside that, on top of that, I know what it feels to have HIV because I'm HIV positive. And when they hear that from me and they know, like, you know, I can be a role model for a community, it's so important. That's why we need everybody on board. I mean, we need providers to understand our culture, to understand specific information. We need providers that understand the language and the pain, because when we say as a Latinos, me duele el corazón, that doesn't mean we have a chest pain. That means we have emotional distress that we don't know what it is because we're not educated, because nobody taught us to talk about mental health. Because that was something that we never learned. Because our parents never learned, and our grandparents didn't know that. They always tell us, if you're nervous, you can have a cup of tea and you're gonna be okay. The impacts of labor and Latin men and community, it's the system. We are a community. We are hardworking and we are providers. And our program is helping these guys, helping men and women to make sure we have services, you know, after work, to make sure that, you know, that they feel here, that you know, that I understand, and then they know that, you know, I'm an immigrant too, and I have the same issues, you know. And then we become also the family and social problem. That rejection about you being labeled as a drogadicto, as, you know, the rejection that you have from society because you look a certain way, and that effects of all this labeling has a negative underlying effect. The abuse of alcoholism, because I remember saying that, you know, being an alcoholic is okay as long as you provide money to your family. You know, those negative, I would say, situations. You know, I remember guys telling me and men coming to the program and saying, but it's okay, I'm an alcoholic, I don't have a problem, I'm not a drogadic. Alcoholism needs to be more talking about families, and alcoholism is more accepted. The self-stigma of being misunderstood, people telling us that we are that we're unintelligent. You know, all these effects of cultural ideas that make me feel in one point and make them feel in one point incompetent. They can lead to like negative effects in our lives. These, I remember they're saying, like, you know, me doy por vencido, yo no puedo más. Yes, and it's so important to be there for them. That's why I want to say we need all the support we need. I mean, we need all the providers to make sure that they're well educated, they're like culturally competent to help our community. And then on the with mothers misusing substances, unfortunately, our program, you know, most of the women that are going to the program are white. Where are women? You know, something that, you know, it needs to change, and we need to work together to help them, because it's difficult for a woman when it's pregnant to accept that she's using, because all the legal persecution, they don't want to lose their children, or, you know, they don't want to talk about it.
Thank you, Daniel.
No problem.
Hi, everyone. So I remember counseling a 49-year-old Mexican man who was struggling with chronic alcoholism and was also using meth. While he was under the influence, he was attacked in the streets of Oakland, and he ended up hospitalized with severe head injuries. His family made several attempts to help him by taking him to detox services, inpatient services, from where he ran away many times. The client had been drinking since a teenager and started abusing meth in his late 20s. When the client first stopped using, he reported that he struggled with hearing voices and sadness. The client struggled with the stigma of mental health and having the need to take medication. I found myself really normalizing the need for help and bringing that desire to help as a challenging himself to take a look inside. I reminded him he was in the right place, that he was brave and courageous. While in the program, he gained knowledge in recovery tools and helping coping skills. He ended up making amends to his family, and they allowed him back into their lives. Today, he has been sober for 5 years and reports that he is helping others who struggle like he once did. So I, here at El Chante, we are, we receive the high level of care clients from Alameda County. The majority of them come from the streets or from being hospitalized, from psychiatric hospitals, Santa Rita jail, or mandated by the court. We are the only program in Alameda County that offers bilingual services. So, you know, we try to accommodate, we have groups both in English and Spanish, and we try to make sure that we have both of the clients in the same curriculum and working together. Although they have to separate at times, we work with them together. Right now, this group that we have at the house right now, it's something beautiful is happening. The clients get to be themselves. They get to share their struggles with their sexuality. They're welcome to be themselves here. They share with everybody the stigma from the Latin community of being gay or being part of the LGBTQ community, and here they're able to be open about themselves and you know, be who they want to be. Once they're here at El Chante, we help with everything pretty much. We help them get, sometimes they don't have any identity. They don't have birth certificates. So we make, you know, we contact where they're from to try to get birth certificates, to try to get them some sort of ID. We get them assessed for psychiatry. That's also another stigma in the, as Daniel was sharing, that's also another stigma in the Latino community, that a lot of our clients here are skeptical about getting services for mental health because they feel like it's only for the locals, and so they don't want to get any services. And so, you know, here we support them with understanding that it's okay to get the help you need so they can be successful in their lives once they leave here. We have trainees that are supervised by Dr. Jason. And they come and they offer therapy to our clients every week. And once again, like I said, we help with everything, with resumes, with applying for Medi-Cal, for EBT cards, etc. Any kind of social services that we can get for them, we help them get that. So usually we get we get the 3 U's. We get 1, 2, or all 3. So the unseen, the undiagnosed, and the undocumented. We have a hard time getting them assessed because if they don't have Medi-Cal, if they're not documented, then it's hard to get them through the access line with Alameda County for them to have a primary psychiatrist because they're not covered. Like I mentioned earlier, we are the only program in Alameda County that accepts monolingual in Spanish and who are undocumented. In any other program, they must speak English and they must be documented because they need Medi-Cal in order to attend their services. We have a lot of clients who struggle because their own family members attack them for being here. I once also had another client who I work with who struggled a lot because his father told him that only girls need help and only girls will come here. And, you know, now he's been clean and sober for a year and he was not accepted to go back home. So he's currently in an SLE, in a sober living environment. So here, you know, we try to work with them so where they can accept themselves, move on from their past, and get them the help that they want with. A lot of them also struggle with homelessness, and that's part of the drug abuse. So, you know, here we try to get them hooked up with jobs and possibly be able to pay a SLE from here on for them. Alameda County does offer something called recovery residence where they go for 6 months and we try to get them there. Also, once they're here, we have to break the ideology of the jail psychology. I've heard a lot of times when clients come in and they know they're getting here from Santa Rita, I hear were you with the greens or with the reds? And I guess the people in Santa Rita who wear the greens are in the psychiatric guard, and the reds is because they have been PC'd or they're brats or you know, somebody who they can't trust. And so once they come here, we have to work with that and help them break those patterns, and, you know, invite them to join recovery and a clean and sober lifestyle. Thank you.
Thank you, Alda. Yeah, I work with all these counselors every week, but getting a chance to listen to their experience of their work is so rewarding to me. I just want to wrap up a little bit of our presentation today. We'll probably end a little earlier. But so you've sort of heard all the ways that we try to identify the additional labels to struggling with a certain substance, right? That when people come to us at all age groups, they're not just coming wanting to learn how to use a certain drug less. There are all these cascading elements that influence their choice to use and the way they look at their future that's either drug-free or with less problems. The National Academy of Science, Engineering, and Medicine put out something looking at how to change stigma that is from the sort of institutional level down. And I think there's a lot to learn from, and I also think there's stuff in there that I think we have been doing. Contact and experience is key. In the residential home, we're able to have a diverse house find ways to care for themselves, each other, and the house in which they all share, with very different backgrounds, futures, and ages. But it's through that contact and the experience of sharing our stories that we begin to stigmatize less or see the world more free of label. We talked a lot in the different programs about self-acceptance being sort of a key to changing. I think in the sense of SUD recovery and all that is taking place, self-acceptance starts to build the self-esteem to keep going. The self-acceptance starts the process of believing in oneself to continue to go through all the ups and downs of recovery, as recovery can be a lifelong project. We tried today to emulate empathy through the way we spoke about our clients, through the way we talked about our work, to sort of show you the way we live our work through and how we try to embody empathy within our work, our daily interactions. Stigma, labels, it's also about anticipation. Knowing what our folks are up against and being able to hear it and anticipate the challenges to meet them. When we have more empathy for the different cascading issues that our clients come to us, we're able to anticipate the next person who is in need. Mostly we've talked about the forms of communication, nonverbal and verbal, that begin to bridge a gap between the labels that push each other away from ourselves, from one another, that cast a certain future or expectation that feels painful. But we obviously need to do a lot more. There's never enough empathy that one can have for the different challenges that they'll hear in this work. There's never enough contact or experience till you feel like, yeah, I got this, or I understand this cultural salience for this individual from this place who has been living here this long. And most importantly, our mental health literacy. That's how we talk about what's going on to our clients. That's how we write about what's going on with our clients. That's how we, as an organization, create resources that are catered to our different populations in a way that makes sense. And if we're not really thinking about how we're conveying these messages, then we're not quite being considerate of the differences of the people we're speaking to. This is a thing that we need to continue to move forward with as a society and as an organization. You know, even in our department, we've begun to rewrite some of the intake forms and the program forms for when the clients come in, what they expect. We're looking at the language of what they read and are told to expect in treatment. That is less pathologizing, less stigmatizing, less confusing. But this project has just begun. If I could distill one thing that is going to be the ultimate challenge moving forward that will always change, is our forms of communication and our forms of delivery of mental health information. that's our presentation for today. We really appreciate everybody sticking around with us because we know we're the last one today. And so some of you have been listening to a lot of conventions here and talks. I really appreciate your attention, and I really appreciate getting an opportunity to share with what we do with all of you. Lastly, I just want to say I'm really proud of my counselors, and I'm very happy that we could spend this time with everybody.
Yes, thank you. And if you guys have any questions, we're more than happy to answer any questions.
Indeed, thank you, Eric.
I'm seeing a question in the chat.
Okay.
I understand that often the entire family system also needs targeted support to address the impact of substance use. It has been challenging for me to find resources in Spanish for family members that is culturally relevant. Do you recommend resources for family members?
Definitely. And I think that involves addiction is a family disease, right? We want the clients to end up going back home, and once they complete the program, it's a relapse prevention tool. So making sure that the family is aware of the ways that they could support their children, and everyone else could add on to like out with the residential. But with youth, it's vital for the parents and the family to know this is what I need in order to be safe at home. For example, if it's an alcohol problem, right? And they have issues with drinking alcohol and it's accessible in the home. How can we make it so it's not there to trigger them when they go open the fridge? Because we want our youth to be safe at the end of the day, and referring them to resources. And also sometimes that involves doing a collateral service where the parents come in and we meet with the parents and the youth at the same time and make them aware this is what's happening and this is what the youth needs from you. And we also get to hear the piece of what the parents want from the youth, right? And it's a collaborative, we collaborate with everyone to make sure that they're aware that it's not just the youth who has the problem, but they need the support. And there may be other pieces that they may need referrals to, such as mental health, right? Or family therapy. And that's where our psychotherapists go into effect. We have a psychotherapist at the office within our youth program. And if we do identify a dual diagnosis client, I'll address the substance use counseling while Zach, my coworker, will address the mental health piece. Does that answer your question? I'm sorry.
Yeah, and I'll just—
Yes, thank you, she says.
And I'll just add that SOMSA is trying very hard to create resources that are culturally sound, because there are a lot of Spanish resources on SOMSA. They've done well to do that. But I have to say that some of the language is a little bit stereotyped, but I think they're working really hard to create resources like for families to anticipate when a family member their use is problematic, or how to make signs for when that use is problematic and talk about it. Or they have a resource about talking about depression and alcoholism in Spanish. And I think it's very effective, but I think we're still, I think that the movement is still to go from what sometimes can feel stereotypical to something that really resonates, if that makes sense.
There's another question. Marlene, do you want to say it yourself or shall I read it?
Okay. Am I audible?
Yes.
Great. Yeah, I was just wondering about if you have any resources on how to navigate, in particular, I find I struggle with marijuana use in families with I guess, different levels of acculturation, you know, where maybe in the Bay Area, marijuana use is a little bit more socially acceptable, but in the home, it's considered to be, you know, it's judged very heavily. And I was just wondering about any resources to navigate those conversations. Oftentimes, I find like families have very punitive judgment and opinions that seem to lead to some behaviors of more like secrecy and hiding. So I was wondering about that, particularly for Latinos.
Erica, do you want to say anything about that?
Yeah, I added that in the piece of like the chats. It was brief, but more so I think it involves a lot of like engagement with the families and like education as to there's not one substance that's better than the other, but more so the education around like what is it around the misuse, around how to get them the help that they need. Sorry. So it involves around like educating the parents, that it's not such a punitive approach, because yes, in Latino families, we find that alcohol use is more acceptable, right? Especially, I found that in youth who just came from Honduras or Guatemala, it's acceptable for their children or their youth to drink alcohol, but it's like a big taboo to smoke marijuana, right? Because they're barely getting used and they don't know that it's more acceptable, especially in the Bay Area, like you mentioned. So the idea would be getting them educated as to like, they're all like the same thing. They affect their brain in a way that it could become an addiction, but meeting the youth where they're at is very important, and getting them their services or resources. I found that a lot of the youth that I work with that are UIY don't want their parents to know that they're smoking marijuana. So they'll consent to services with the idea, and I always share this with them. The goal is to eventually speak to parents and let them know that you're involved in these services, so you can get more support around it, right? And because they'll hide it and then they'll get caught and there'll be like a big disagreement at home. So I think more so of the teaching our parents to meet their youth where they're at, their children where they're at, and not taking like a very punitive approach, because that's usually not effective with youth. And then offering resources like the ones with substance use counseling, if that's something that they really think that their youth is struggling with.
Yeah, I think something that's special about the youth program is that there's a way to begin to engage youth without identifying them as having a substance use disorder yet, right? That youth treatment under our Medi-Cal system is about also teaching our students who maybe haven't quite developed a substance use disorder or problem yet to get that early intervention. Because I think it's part of what Erica said earlier, which is that there may be a view about productivity and ability to work and have a job, where it's possible that marijuana is looked at, it will lead to laziness and not having a job and certain things like that, where alcohol isn't exactly perceived that way. So Erica's spot on with like looking at, well, what's the fears around it and what are the reasons for using?
Great, thank you so much. I appreciate the perspective.
Sure.
Hey everyone, so it looks like we're gonna likely be wrapping up in the next few minutes, unless there's any other questions that you'd like to ask to the panelists. I don't see any more in the, it looks like it says, can we get your contact information for the facilitators in case we have follow-up questions after the presentation?
Yes, I didn't get a chance to put it, I was gonna put it into the presentation and then it'll be available to everybody, is that right?
Yes, you can include it and then we'll be able to share slides.
Okay, that'll be the plan.
All right, wonderful. Any last questions in the last 100 seconds that we have left? No? Okay. Well, I just want to say muchísimas gracias and thank you so much to Jason Erika, Daniel, Aura for your presentation today and for being part of La Familia and for serving the collective community that we're here to support and that we're a part of. So thank you all for joining this workshop.
Thank you so much.
Yeah.